I think lung cancer awareness is critically important because while we've known that there's been several links, particularly cigarette smoking being linked to cancer, despite knowing that for decades it's still the leading cause of cancer death in the United States, even though it's not the most common form of cancer. The other thing I think is critically important is screening, which not all patients know about. Lung cancer screening is not as prevalent or talked about as mammograms for breast cancer screening or colonoscopies for colon cancer screening. But I think it's critically important, and then even if you've had a smoking history, even if you've quit years ago, I think screening is critically important, and to talk to your primary care providers or your thoracic surgeon about getting the appropriate lung cancer screening to detect cancers early when they can still be treated. So the best recommendations is talk to your primary care doctor, and they can kind of put it in common terms, but it's a certain age range and smoking history that would qualify you for lung cancer screening. The mode changes, and we're trying to bring that down in terms of how extensive your smoking history has to be in terms of pack years, but also what the age ranges for appropriate cancer screening. Robotic surgery is a different form of minimally invasive surgery, same as what used to be called VATS, or video-assisted thoracoscopic surgery. It's essentially the same techniques, just rather than the surgeon controlling an instrument, the surgeon is controlling a robot that controls the instruments. It a little bit is due to surgeon preference, the VATS technique versus the robotic technique. But there are differences in being able to harvest lymph nodes in terms of surveillance for the cancer long-term, and as far as the level of resection goes. And then within the robotic field, there are different technologies that are coming out to the robot itself, both for localization techniques, meaning camera modes and imaging strategies and dyes that can be used to more directly target a cancer within the chest, as well as some newer robotics are trying to get what we call feedback, where the surgeon can sense at the robotic console itself the tension that's being placed on the robotic instrument, which was previously not available.